to get started here. I want to get started here pretty quickly because, again, I want to make sure that we get everybody's questions answered. One of the big questions that we actually get here is, who can I do billing for? Is this platform for hospital billing? Is it just for doctors only? Is it for dental billing? And the reason that we put this up here is to kind of show you a graph of a little bit of why we focus our attention on what's called the professional billing. And that's that physician and clinical piece of that pie that you see there, that 20%. The reason we focus in on that is because if you try to get a hospital to do hospital billing, let me just tell you from the years of experience I've been in this business, it's going to take you some time to actually get an appointment and then go through all the committees that you're going to need to go through just to hopefully get that hospital billing. Plus, you would actually need to ramp up staffing to be able to do that. So the reason we focus on this particular area where it says the physician and clinic, because that's the easiest ways to be able to get into the healthcare business. First, you're dealing with just the doctor. That's the decision maker. They don't have to go through any committees. You don't have to go through much, but at least that's the slice of the pie, and that is a ton of money. As you can see that it's currently $614 billion annually in that. So as you've heard Patrick in the past, he says you just need a little slice of that pie of that 614 billion, and it's actually growing from there. Now, one little thing that a lot of people do ask is, can your platform do dental billing? Our dental billing software is actually separate from the iClaim platform that we're going, and it will show you today a little bit. But folks, actually you can see in the healthcare industry, you can see that dental services is only 4% of the total pie. So again, when you're thinking about starting your business, you want to know and launch it in an area where it's as great as it can be. So you want to go into a market that's big enough to where you can go after that. And so again, that's why we focus our attention, and that's why we do a lot of our focus in on when we're dealing with doctors. And that's what I'm going to focus in on today as I kind of run you through the numbers here. A lot of people also want to ask, is there truly a market for medical billing? Well, according to Entrepreneurial Magazine, they think so. They actually have you can order this off of Amazon.com. You can go there, go start up your own medical billing business services, and I think it's $24, $25, maybe less than $30. I actually think it's a great investment if you're thinking about this. It's just another piece of the puzzle that kind of help you understand as you do your due diligence. And so you can see some of the quotes that they've got listed here. Well, the first quote that we like to kind of talk about is how big is this medical billing market? So you can see here the market for medical claim billers is growing exponentially with the legions of providers and an ever expanding patient pool, which we know that, people turning 65 or older, there's 10,000 people that are turning 65 today and every day. So that patient pool actually gets larger. Healthcare industry spending is expected to grow by 5.8% each year through 2024. So folks, again, as you're thinking about what kind of market do I want to get into? Do I want to get into where I'm doing a franchise with making sandwiches or flipping burgers or whatever it might be? Or do you want to be in an industry that has a significant industry growth, as you can see here? The second quote here, as you can see here, it says, by then, healthcare spending will total 5.43 trillion and account for almost 20% of the gross domestic product. Folks, again, if you keep up with the numbers, what's going on, that's pretty significant. So the pool of your potential clients in this industry, remember, folks, when we talk about it, we want to help you, first of all, get that first client. That's our goal, to help you get that first client, because once you've got that first client, the next client comes pretty easily after that. And you're going to see now today, whenever I go through these numbers all you got to do is duplicate what you've already done with one doctor, and you'll see that having a small slice of that pie here as part of the money that you can make in medical billing is pretty phenomenal. And you talk about scaling this up. That's what you're going to need to know how to do. If you want to keep it at a certain level where it's just you and maybe another business partner that you're working together, you can easily do anywhere from $10,000 to $20,000 a month in revenue with maybe 2 people. So that's pretty significant whenever you're thinking about business. Now, also, I'd like to draw your attention to a third-party group that we can kind of keep up with, and that's called the Black Book Research Group. Now, Doug Brown is the managing partner of Black Book, and they state in their material, rising healthcare expenditures is creating the urgent demand for cost-effective, technically advanced business office outsourcing solutions in physician practices across the country. Well, that's what we're all about. We're getting that doctor to outsource their billing out of their office to you. And some people will think, well, gosh, is that going to have someone lose their job in their office? Not necessarily. Remember, if you think about this holistically, you're actually going to help that doctor's office increase the performance of their office by getting that out. You, as a certified medical revenue manager here, as an independent medical revenue management group from ABS, you will be able to do more than just their billing. You just think about the collectiveness of performance improvements that you'll actually be able to do in that doctor's office. So again, there's so much more than just doing the revenue cycle management. Again, some of their statistics are going to go like this: 42% outsourcing medical billing is expected to report an overall 42% growth rate from the period of the quarter Q4 2016 through Q1 of 2019. So you're thinking, oh my gosh, I'm about to run out of time. Listen, I've already shared with you some of the numbers that are staggering out there that are already increasing, but still this growth is still growing as we go through this. Here's just some more information that I really want to get to some of our other slides here. But again, when we talk about getting the doctor's money, we want to hear from what the professionals are saying. So there's a group out there called Avia Code, and the head of that group, called Mike Ingram, Mike says the average physician could increase their monthly billing by 30% if their medical coding was done accurately. Now, some of you already may be thinking, oh my gosh, does that mean that I have to do coding? You're going to see today one of the solutions that we have, which is called CodeWrite and Audit Guard. That takes care of all the coding that you, as a certified medical revenue management company, will be able to provide to the doctors. So let's get that question out of the way. Are you going to have to know coding? And the answer is no. We're going to be able to be here to help you with that. So as we keep going here, I'm going to get into some of your questions, but again, just setting some of the stage here, again, from the New England Journal of Medicine. They state that market analysis estimates that 24 cents out of every dollar are wasted on administrative and medical billing expenses. Now again, folks, this is not American Business System saying this. This is the New England Journal of Medicine. And if you think about it, that's 24% of the doctor's money. Some of you have been on other webinars. We've talked about claims that are not getting paid, which are rejected claims. We also talk about the amount of money that the doctors are not getting. And we kind of stay within that group between 20 and 30% of the money that the doctors never end up getting collected. And there are a myriad of reasons why. One of them can certainly be just simply some coding issues like we saw earlier. There could be some issues where the front office may not be checking insurance eligibility all the time. It could just be claims that are just not ever getting processed. So there's a lot of different aspects of this that impact why why the doctors are just simply not getting paid. And again here, if you think about it, 24% out of every dollar, that's the problem. All right, so what we're going to talk about today, just in brief, one of the things I like to kind of discuss here is for you as a prospective investor, basically in yourself. Yes, our investment here is $26,990, so it's a one-time investment. There are no franchise fees. There's no royalty fees. But what we're concerned about is you getting that $27,000 back in an investment. And that is, for some of you might already know that, that's called your ROI, or your return on your investment. So what we know that needs to happen, what needs to happen is if I invest $27,000, how do I replace that $27,000 and how quickly can I do that? For some of you, it might be very surprising that this can actually be done at least within the first year. And I say usually within the first year. It's going to depend upon some of the other aspects of how much marketing you're going to be able to do, how you're going to be out there working with the doctors. And sometimes, folks, it's just dependent upon the doctors. When are they ready to move forward? So even though that we have a very high success rate of getting those doctors converted from seeing a demonstration of the iClaim platform and then getting that doctor signed, is usually about 50%. So we got a great return on how and what that happens when we do that. But again, we want to make sure that we get that information in front of you so that we get you in front of that doctor to actually get that demo so that we can get you well on your way of your return on your investment. So that's really what we're going to be kind of discussing today as we go through this. So obviously we were talking about today how much money can you actually make in this? And folks, we're going to try to be as realistic as possible. Matter of fact, the numbers that I'm going to use today are going to be actually very low. We don't want to blow up the numbers. A lot of people ask me, can I grow this business up to where I have 10 doctors, 20 doctors, 50 doctors? Yes, you can. But again, like I mentioned earlier as we began starting this webinar, what we're interested in is how to make sure that you get the first doctor. Because if we can help you get the first doctor, then the second doctor, again, will come pretty quickly for you as you go through everything that you need to go through. I'm just trying to get my timer set up over here so I don't either go over the time that we've got allotted today, because once I get started, I could go on literally for hours this afternoon. All right, so here's where I'd like for you to start. If you haven't already been to our website, you can go there, go to absystems.com. When you get to absystems.com, if you haven't already looked at the income potential, go there, and then right under income potential, go right here where it says medical billing income calculator. Now again, we have disclaimers there stating that nobody can guarantee any particular numbers for anybody. But what we try to like to do is at least, again, start with the one doctor that sees an average number of patients on a daily basis, how often that they're open through the week, and we know that most doctors are open at least 5 days through the week, which will calculate out to about 20 days a month. I mean, it's so simple to if you think about it. 5 days times at least 4 days of the 4 weeks of the month, then you're able to get to the numbers that we're going to be getting to. Now, I know that some of you that I've already talked with several times that you've got some questions about what percentage can I actually charge a doctor? Well, from our experience, it's going to be anywhere from 5%, maybe up as high as 8%. So you can still see that we're kind of low on that end there when we still have 6% of what kind of money you can make on a $100 claim. Now, I will address this as well because I know somewhere in the list of people that we have on here today, someone might already be familiar with billing, and there's what's called a submitted rate or a submitted claim amount. That's how much the insurance claim is actually going to be sent to the payer. But then then you have what's called the reimbursed amount, what they actually end up paying back. So pretty much we know across the board that the average reimbursed amount from any doctor is going to be right about $100. It's not always $100 right at that part, because obviously we've got the federal money that comes in, so it might be a little bit less. But then you've got your commercial payers who may be paying a little bit more. So again, when you take all those numbers and you average those out and you wash it out, it's usually about $100 per claim on the reimbursement side of it. So that's the numbers that we're going to be working with this afternoon. One doctor seeing 25 patients a day, open 5 days a week, charging 6% of that money of $100. So let's look at how much money that is actually going to generate. So let's click on submit. And so what that's going to bring us back with one doctor is a total yearly gross income of $39,000 a year for one doctor, with an average monthly gross income of $3,250 a month. Well, for some of us, that's not too bad, but we're going to even make it a little bit better, because we got to factor in how much time does it take for you to work that one doctor. Well, on average, again, from our pool of licensees, it normally takes about 2 hours a day to generate those claims in order for you to get that doctor's reimbursement money back in, and then generate this type of money. So if you think about it in a little bit as globally as we can think about it, is that 2 hours a day could generate about $40,000 a year with one doctor. And again, we're dealing with someone who is just a general practitioner. Now, I'm going to break those numbers down here just real briefly, but before I do, I see that there's some questions coming in, and I'm going to see what I can do to help answer some of these questions. So the first one that I see here is from Diane, and Diane's asking the question: the medical billing market is expected to grow by 5.8% through 2024. Does this refer to the physicians and clinical portion of that pie, or is this a total medical billing? No, it's actually just the actual physicians in the clinic part of that. So that is significantly the part that we're interested in. Mark is asking this question: what is the clearinghouse fee per claim? Great question, Mark. So let me address that. For some of you who are brand new to medical billing, I'm going to take just about 30 seconds to 40 seconds here to explain what a clearinghouse is. First of all, you have a system like iClaim, and that system will generate and create a claim electronically to be sent to some payer. But it has to go through a clearinghouse before it actually gets to the payer. Mark, if you haven't heard from us yet, our clearinghouse is actually integrated into our system. So we get to skip that whole process. So in actuality, there are no additional clearinghouse fees with our iClaim platform. So what I'd like for you to do, Mark, if that helps make some sense to you, get back with the business coach that you're working here with ABS, and we can even go a little bit further with that and even show you a demonstration as we can help you out with that. All right, so Claude's asking a question here. So a single person can process 10 GP claims an hour. What about specialty claims? Okay, so let's talk about that real quickly. So a single person can process 10 general practitioner claims per hour, and that's about right. So whenever it gets down to a specialty claim, we're talking about that, and we're actually going to look at both of those today. One that's a general practitioner, and then one that is a specialty. We're going to actually look at the one that we're going to look on the specialty side is actual numbers from one of our licensees that gave us the information on this. We're actually going to look at a urologist. Now, obviously, when you do processing of claims of a specialty, it's a little bit different than just a regular general practitioner, because there's going to be some more complicated things that go on that. So you could probably add about another 30, 40 minutes on top of that. But remember, one of the goals of what you're wanting to do is get that doctor or that group of doctors on our EMR system. And if you've got that accomplished, then the numbers of the time kind of falls through the floor again, because now you've got a lot of that work already done for you. All right, so here we go. We're almost at the bottom of the hour already. I can't believe that we've gone already about 25 minutes into here. So let's kind of jump in here and let's kind of start working some of these numbers. Now, I showed you on our website where to go to plug in whatever numbers that you want to plug into. But again, we're going to stick with the numbers that we use, because for me, it helps me to understand how did that get calculated in there. So this will kind of help you understand how you can calculate this without even going to our website. But obviously, the website's a little bit easier because you'll be able to see it from there. So first of all, let's talk about a general practitioner. A general practitioner, again, is going to see about 25 patients a day, and the average reimbursement for that each of one of those patients is going to be $100. If you think about it, folks, if you go to the doctor today and you're just a cash pay, you can be paying $100 to $150 already. So you kind of know that that number is a fairly decent number. Not unless you're dealing with a chiropractor, because a chiropractor is going to charge you to go get seen by a chiropractor for about 5 or 10 minutes. You may be charged even with that anywhere from $50 to $60, maybe $70 per chiropractor. So as a general practitioner, we're not too far off on these numbers. So 25 patients a day, $100 per patient, that generates revenue to that doctor. If you think about, we got to put ourselves in the mindset of a doctor. So if this doctor is seeing their patients, they're thinking, okay, at the end of the day, I need to be making X amount of dollars. So let's just call it $2,500 per day. So if we go with those numbers, then we've got to start calculating that out again. So from all the insurance companies, so over a period of time, and it's usually over a month's period of time, we know that somehow these doctors are going to get paid from Medicare, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, whoever it may be. This doctor is going to be paid electronically. So another good thing about being in revenue cycle management today is that you personally will not have to handle any of the doctor's cash, checks, or anything else. Now you'll be managing that. Let's don't get that confused of managing it. All that'll be managed in the iClaim platform, and that's why they're paying you a percentage to help that money get in. So let's say $2,500 gets to the doctor here, and now again we see if the doctor is open at least 20 days a month, we take that 2,500 times 20 billing days, and that's an expected revenue resource for that doctor of about $50,000 a month. Okay, so you think a general practitioner is averaging about $50,000 a month in expected revenue. Now, let's just add a couple of little nuances here. Now, remember, if you remember from some of our previous slides that we've already had, remember that some doctors are losing about 25% of that money on average. So imagine cutting into that already. And the expected amount of revenue is going to be $30,000, maybe $35,000 out of there if you start thinking about it in those terms. And actually, with the rent and the staffing that they have and everything else, that money doesn't go very far. So what we want to do is get those doctors up as high as 100% as possible. So we're looking at these numbers here. So $50,000 per month in revenue is expected. Now, they've got to pay someone to do the billing, and that would hopefully be someone like you. And so now the time is the doctor's got all of their reimbursements, and at the end of the month, you calculate that says to say at the end of the month in the report that you help that doctor collect $50,000. So let's take that, look at it in a different way. Again, $2,500 a day for the doctor times 6%. You could be averaging your earnings of $150 a day. Remember, that is 2 hours a day. So if you think about it, you've just given someone an increase of about $75 an hour of actually doing processing of medical claims. So if you think about it in those terms, this can get pretty lucrative for yourself as you go about it. Again, taking usually at less than 90 minutes a day. So if you take that $150 a day times 55 days a week, again, your earnings are going to be calculated as we see here. About $750 a week times 52 weeks of the year, that's about $39,000 a year in revenue to you. And if you think about it, that could be just part-time work. And yes, folks, some of this can actually be done after hours. And a lot of it, majority of it, can actually be done after hours. So if you've got, some of you may go into work early, maybe for a 6 to 2 shift, and that leaves you a little bit of time in the afternoon to be able to do some of this. That way you can get in some of the last hours of working with some of the insurance companies if you need to work with them, or you get in a little bit, you go in a little bit later and you can do some of it in the morning, or you're just going to do mostly all of it over the evening. And the great thing about it is, since it's a web-based system, we've heard Patrick say before, the internet's open 24/7, so you can literally do any of this work at any time. So folks, that is with a family practitioner, just a regular general practitioner, regular family doctor that is seeing that. Now, I don't know about you, but it seems like whenever I go to the doctor, there's 25 patients in there whenever I'm in there, whether it's in the morning or in the afternoon. So you can see here, that the number that we're using here as the average number of patients a doctor is going to see can certainly be any type of number. So the doctor could literally be seeing more patients, and a lot of doctors do try to see a lot of patients. And let's answer the question why they need to try to see a lot of patients. Remember, they're trying to recoup money that they know that they're not already going to get. If I go back to those slides of talking about, you've got an average doctor may only collect, you know, less than 24% of their money, or 30% of their money, or 20, or even 15% of their money. They know that they've got this average here that they're only going to collect a certain amount of money. So what are they going to do? So let's see more patients. So what does that do? It adds more stress on the staff. It adds more stress upon the doctors themselves. And it actually adds more stress upon the patients, because now the patient will say, gosh, my doctor will only see me 5 minutes. In and out, in and out. I don't know about you, but I'd like my doctor to stay with me a little bit longer. But how can we do that? Someone that's a certified medical revenue manager that gets their money, the doctor's money back up. Imagine what you're doing for truly your entire community. You're really providing a better healthcare service for your entire community. So that's just one of the things you can kind of be thinking about as we kind of think of it a little, getting our heads out of the weeds a little bit on all this. So it really impacts everything that you might be doing. Okay, I see a question is coming in. Mark says, thanks on that. That's good. Alan says, is there also a market for the growing integrative practitioner market? You bet. Alan, I'm glad you brought that up. A lot of people don't know what integrative medicine is all about, but that's more doctors that are kind of going a little bit more natural. They tend to, a lot of our DO doctors already, so they're doing a little bit of medical side of it, but they're also doing some more natural part of it. So absolutely. Matter of fact, the doctor that my wife and I personally see, we actually do a lot of things for her and making sure that a lot of her stuff is taken care of there. So the market for that is actually growing pretty well. Jiger, I hope I'm saying your name correctly, so forgive me if I'm not, but why will the doctors pay as much as 5 to 8% of said in hiring a full-time person at the office? Great, great question. Because a lot of people will ask that question, why will a doctor just not do it in their own office? Folks, if you think about it, right off the bat, now I've left this slide up here. Most full-time employees of a doctor's office is already close to $39,000 a year. Now you got to take the cost of their software, their cost of their clearinghouse, the lack of money that they're already making. That's all calculated into what we teach here for our brand new licensees, is how to do what's called a practice analysis. It can be divided in two formats. One, if a doctor has a medical full-time medical biller, or if they've already got it outsourced. What we calculate whenever a doctor has a full-time employee, they're actually spending twice as much as the numbers that you've already stated, 5 to 8%. The doctors are finding out when they literally don't know how much money that it costs to get a claim out when they've got a full-time employee. It really is anywhere from 12 to 20% of what it costs to get a claim out with a full-time employee. That's shown in the practice analysis, and that's a big, big help for a lot of doctors, because again, they've never even seen that type of a practice analysis or any type of analysis. Okay, Claude, you said that most of the work can be done in the off hours while holding a full-time job. Is there any aspect of the medical billing business that has to be done during the 9 to 5 work? Did you mention dealing with insurance companies? I did. There's sometimes, Claude, there may be some times where you might need to get in touch with some of the insurance companies. But again, some of the insurance companies hold longer hours too as well, because not everybody can get in from that 9 to 5. If you think about it, a lot of insurance companies have to be open from coast to coast. So if you think about it, you know, on the East Coast, a lot of those insurance companies are opening. On the West Coast, they still have to stay open. And a lot of this can be done via email, of asking questions and coordinating things with that. So a lot of this actually can be done off hours while, again, still holding their full-time jobs. Chad is asking, does hospitals use this? No, hospital billing is separate from medical billing, or what we call professional billing. It's a great question there, Chad. The question is basically, can I use the iClaim platform with a hospital? Just kind of also give you a little education here. We love to educate during our webinars. So if you think about it, for the doctors, general practitioners, and what I'll get to here in just a moment on the specialty, that's what's called professional billing. Hospital billing is what's called institutional billing. And so we focus our attention here on the professional side. That's what our billing platform it sets up there. Let's see, Ben, do you help define our leads to customers or physicians? We do, and that's all done through our training workshop and some of the things that we do after all that, Ben. So absolutely. So again, that's a great question to spend a little bit more time with your business coach here, and that's a great question to keep following up on. Alan says, I'm assuming you'll send us a link for the demo. How does a demo typically, or how long does a demo typically last? How many doctor does your lead generations tool give us the ability to see this per week? All right, so Alan, real quickly on that, and I've got some other questions that are coming in, and I'll have to keep going on with this because I don't want to get off topic too terribly much. But if you want to see a live demo of the current software that we're working, get back with your business coach. It normally takes us about an hour to kind of complete that. It's all based upon a lot, again, your questions that you asked, and that question there of helping you get lead generations, which is kind of like Ben's question there, will assist and help you with that during that particular call as well. All right, so again, folks, so I don't get too far off. I know that some questions are still coming in, so bear with me. I'll try to get as many of those questions answered before we get through with the webinar today. All right, so let's shift gears here. So now we're going to go from a general practitioner to a specialty. This is where, to me, it gets exciting because I can say from personal experience, my wife has done billing. Her first doctor that she ever worked with was with a specialty group. And so the numbers at that point can truly be staggering. But again, before we go there, again, let's just kind of look at this one more time, seeing again that you've got one doctor seeing 25 patients 5 days a week. 6% of that is going to you for your pay on that at $100. Again, click on submit there, and again, that gets you back to that $39,000 a year. Now, folks, again, you can adjust those numbers. So get in there and play with it a little bit. Just play with it just a tad. But again, for a general practitioner, you don't want to go any higher than really about $100. So if you want to put 5% in there, put 5% in there. If you want to put 7% in there, put 7% in there. But again, when you're thinking about a general practitioner and a family doctor, that $100 mark is right where it probably needs to be. So just kind of play along with that. Now, again, so who are some of the people that can be your clients? And a lot of people, again, are asking these questions. So obviously family practitioners, rheumatologists, pain management doctors, they're a good specialty to work with. Immunization people, pediatrics, radiology, oncology, any of the oncologists. Again, we're talking about some specialties here. Foot and ankle doctors, that would be obviously podiatry, geriatrics, you know, any of these, or pediatric medicine, pain management, again, physical medicine, plastic surgeons, any type of surgeon that's out there. So again, I'm just kind of putting some of this up there so you can kind of have that in mind, because we're leading to the specialty. And the specialty, again, that we're working with, again, is based upon some numbers that we've got from one of our licensees who actually worked with a urologist. So again, you know, a urologist is going to be more along the lines of your kidney doctors and kind of working with that. And so that's sole specialty there. So we're going to take the same amount of patients. The only thing we're going to do at this point is increase the amount the doctor gets reimbursed on. So that's the only part of the equation that we're actually going to change. So we're going to see that this doctor still have 25 patients a day. And as you can see here, instead of $100, we're going to average out of $175. And again, you can see that it went from $2,500 a day up to $4,375 a day for that doctor. So that's a pretty significant jump there. almost 50%. I mean, we're almost at $200, so we're at $175, so that kind of makes sense there. So there's a significant increase. Now, the great thing about it is, with this, there may be a little bit more time spent, but not much more. But remember, I said you may spend another 30 minutes more on this. Instead of it just being 2 hours, it may be 2.5 hours. Because again, there's going to be some specialty things that you might have to be working with there. So again, 25 patients at $175. Again, that's going to generate $43.75 back to the doctor on a daily basis, so to say. Then let's take a look at this. So now we take that $43.75. The average number of billing days, again, is still 20 days a month. And now instead of $50,000 a month, now we're at $87,500 of expected revenue for that particular doctor. So some of you are already thinking, okay, I might be going after a specialty already. And that's what you should be thinking. And a good thing to kind of know, because a lot of people I talk with on a regular basis say, I already know that a lot of doctors are probably already with some hospitals where they're with some big groups. Folks, the specialty area, most of those people are still independent, and that they do independent work. You may find a small group of surgeons, orthopedic surgeons. I know with some of the doctors that we've seen, we came across a surgeon group that was of 3. They're all independent. They're not part of some big group. So you're going to find your podiatry, urology, orthopedic surgeons. The specialties are going to mainly still be independent, cardiology. So again, this is a great kind of a niche of people that you can kind of look into. All right, so if we're at $87,500, now we're going to take about how much is this going to be paid back to you. So again, if we're at $4,375 a day times 6%, some of you are already doing the calculations here, that's $262.50 per day. Well, that's a pretty big bump from $150 already. So for less than about 90 minutes, or let's say 2.5 hours a day, still, let's see what kind of revenue that you're looking at here. So again, one doctor can generate, again, about $68,000 a year with one specialty. Again, and let's just say that you're working less than 3 hours a day. For most Americans, that's the average income for most Americans here in the U.S. already. It's about $70,000, $75,000 a year. So imagine that you're doing this type of work, taking you less than basically a half a day of work. That's not too shabby. And again, that's where you can start thinking, what do I need to do now to duplicate what I've done? Now, a lot of our licensees, again, have hit, we say, small pockets of specialty groups. And again, like I mentioned to you earlier, it could be an orthopedic group of 3 doctors. Imagine taking this times 3 already. Well, obviously, you already know that's going to be a full-time day of work if you're just doing it by yourself. But you know, at nearly $70,000 a year times 3, you're really getting close to about a $200,000 figure every year working with 3 doctors. Now, again, I hate to even go there, but it's just plausible that you can think about thinking that if I get one doctor at $60,000, $65,000, $70,000 a year, obviously if I duplicate that, I know where that's going to take me, and that's where this becomes very scalable, very fast for you. So I know that I'm working with some folks that are already coming to the October training who's already thinking much bigger than this. I mean, they're thinking about taking over large clinics already. So you can see how, again, very scalable that can look at there. Now, what I wanted to do here, and the reason I go over to here, is you should be seeing my website. And this is our website here at American Business Systems. And again, I just want to kind of show this to you again in real time. So I'm actually gone out to our website. We're right here. I'm at Income Potential. I'm gone right here to the Medical Billing Income Calculator. So I've clicked on that already. So that's where we are right now. And we're going to put in that one doctor, again, at 25 patients a day. And we're going to turn that from $100 to $175. And now we're going to click on submit. Now we're going to do this literally in real time, as you can see that. I'm going to blow that up a little bit so you can see it and scroll that up there. So again, you can see that again, we're at that $68,250 a year. Now, again, some of you might say, look, let's look at that times 3. So we take that times 3, 25 patients a day, again at 175. This is where, again, you guys can go and play with this to yourselves. And we get, again, click on this submit figure right there. And again, there's your total yearly gross income potential, folks, at $204,000 a year, servicing, again, what we see, 3 offices. That would actually be with 3 doctors, and that's your monthly income right there at $17,000 a month. This is why it makes it somewhat attractive for those who are entrepreneurs, and they say, you know what, give me this opportunity. This way I can go out there and build the business that I want to go build. Matter of fact, the individual that we had coming in here this afternoon or this morning, it actually does that. She actually does billing for another group already, and she wants to do her own thing. She goes, Eric, I'm just tired of making money for everybody else. I'd like to keep more of that for myself. Even if she did have a couple of people helping her with working with 3 doctors. I mean, at least at that point, you have become the boss. Now, why can we do what we're able to do? We have the technology here that we just completely say we blow out the competition. And the reason we blow out the competition is because everything that we do in medical technology is all one resource. Why do we use iClaim and EMRx? Number one, it's got mobile charting. It helps increase the revenue. All of the customer service is US based. It's been since 1998 that our platform has been around. It can work every specialty. It's totally integrated. It's web-based. So really, folks, any web-based connection is available for the doctors to get in this. You're working with it. The doctors are working with it. And it's increased and ever increasingly affordable for that doctor's office to be able to have. Here's some of the other awards again. As you saw earlier, I worked with Black Book Ratings, and this is stated to be the #1 rated EHR for osteopathic medicine and OBGYN groups. So again, folks, our platform is solid. Now, before I get to your last minute questions here, because we've got about 15 more minutes before we wrap up here, I want to share with you a little bit more about some of the other services, because I mentioned already at the beginning that, again, a doctor's office can actually increase 30% more of their money if they're using the right codes. And a lot of people at that point kind of just go, oh my gosh, I don't know medical coding. Am I going to have to go to school for medical coding? What am I going to have to do? Folks, we've got that as part of your entire business package, and it's called AuditGuard and CodeWrite. And I'm going to explain those to you real quickly and real briefly. I'm going to hopefully get back to a lot of the questions, because there's a lot of questions that's been generated during the webinar today. Let's first talk about AuditGuard. What does AuditGuard do? Well, folks, I can tell you at any given moment, any doctor could be under 1, 2, and as many as 4 or 5 audits from the insurance companies and from Medicare. So really, folks, any doctor that is really seeing Medicare patients, they're already under the microscope of Medicare, because the government doesn't want to relinquish any more money than they have to, and the doctors don't want to put codes that are going to put them in jeopardy either. So we have AuditGuard that actually helps guard profits, as you can see there, and helps reduce the errors. Now, what I'm actually showing you is one of the marketing materials that you will have here at American Business System. So really what AuditGuard does, it helps review the doctor's charts and identify any possible coding errors. Now, why this is good is because you may walk into a doctor's office and the doctor says, look, I don't want any billing, I don't want to have any of that, it's no big deal. You can literally say, doctor, when was the last time you had someone review your charts to make sure that you're coding properly? Folks, this could be the door opener of all door openers right here to help get you inside that doctor's office and start at least getting the practice analysis done as well as that. Obviously, the other part that I've already mentioned to you is CodeWrite. We already have certified professional coders that will do everything for you. You're going to learn, what you'll learn to do is to scan in any of the doctor's medical charts to a coder, into a coder's queue for coding purposes. Again, you don't need to become a certified professional coder. again, you are that because you will have that automatically when you become part of American Business System as one of your services that you're actually offering to the doctors. So again, imagine again increasing that doctor's revenue reimbursements rates again up to 30% just by making sure that the doctors are coding properly. Now, if that's not good enough, again, I have to go back to sharing with you that you need to go back, and if you haven't seen a demonstration of our software, go do that with your business coach, because already in there, our system is already doing the coding. These services are for doctors that are not using an EMR system. They're still using paper, and there's still a lot of doctors doing that already. So imagine that you could go help that doctor already with information and just, again, sort of getting your foot in the door in this whole medical healthcare business in order for you to get to the prize, which would be obviously doing the medical billing. Some of the other services that we have is what's called Quick Collect. A lot of people ask me and the rest of the business coaches here, will I have to do collections? Folks, this is not calling up the little old ladies and the little old men and bugging them about trying to get their money. I think everybody on here hates to try to get a collection letter from a doctor. It's poor business. And that's one of the things we like to talk to doctors about. Sending your patients to collections is just a bad business deal already. Because that patient says, look, if that doctor's going to do that to me, I'm going somewhere else. I would happily work with them if they would not send me to collections. This is what the Quick Collect will actually do. So imagine helping the doctors manage their receivables is not really as difficult as it seems, but folks in a doctor's office, it's one of the last things that they actually try to do is try to collect that money. Quick Collect can replace the doctor's need for a collection agency, do it all automatically. And again, at this point, once you get the doctor on Quick Collect and they're working this process, you're not having to do any of this. This is all done automatically, and for you, that becomes just more an income stream for you without having to do a whole lot any more than just what you've had to do there. Choice Pay is another area. If some of you have been on some of our recent webinars, there was a huge article that came out talking about higher deductibles. Folks, we're going into the end of the year, going into the first part of the year. Listen, we're already thinking about our deductibles being met this year, trying to have to do that next year. And again, the insurance companies are increasing the deductibles, and more people are just having a difficult time, maybe even affording insurance. Choice Pay is another solution that you can add to that doctor's suite of services in order to give their patients a better healthcare program without creating, again, a bad relationship there. It's giving the patient an opportunity how to make these payments. And again, more money streams come into the office. Again, more money that you're going to be able to make because that's what you're helping the doctors collect. All right, lastly here, iDocs Now. This is an incredible part of it because if you've been to any doctor's office, sometimes you've noticed that you've got medical documents that are all over the doctor's office. And sometimes the doctors are having to pay extra real estate fees, maybe another room, another office there in the suite where they are, just to keep their medical records, because folks, they have to keep them there for a minimum of 7 years. Imagine taking all of that and HIPAA compliantly putting it up in a cloud service to where the doctors can actually retrieve that whenever they need to do that. So it meets all the standards that are going to be needed. It's all encrypted. It's all HIPAA compliant. And again, it gives a doctor opportunities to research and grab anything that they might need there. The last thing, one of the last services that I want to talk about, and then hopefully I'll have some time to go through some of your questions here, and that is Compliancy Guard. Now, let me kind of give you a little tip secret that you're going to learn in our training class already. If you were to go out there and pre-market, a lot of people like to try to go do that. Simply just go do this. Next time you show up at the doctor's office, ask them if you could possibly speak to their compliancy officer. Yes, their compliancy officer, or whoever takes care of their compliancy. You're going to get a look going like, okay, who are you with, or which federal agency are you with? Because folks, the doctor's office has to keep up with compliancy whenever it comes to HIPAA. And so one of the most violated parts of a doctor's office is in HIPAA compliance. And what this service will be able to do, it will simplify the compliance tracking. It satisfies, again, all the HIPAA and all the high-tech risk assessment requirements needed. Again, folks, this would be, again, a lot of the times, the simplest things to get your foot in the door, again, with the doctor. Again, remember, we're concerned with one thing with you as a brand new licensee, and that's helping you get your first client. So we have all these different services to help you be able to do that. One of the greatest things that has been helpful for our licensees is our marketing material. And it's not just the flyers that you have just seen here, but it's actual printed material, real information that you can give a doctor. Imagine, instead of leaving a doctor a flyer or a business card, you're able to leave that doctor a book. Obviously, the book in and of itself is good enough, The New Thriving Medical Practice. But what makes it even better for you as an American business licensee is that we're going to put you as the author of the one that wrote the foreword to the book. A lot of people say, well, if that's a canned foreword, I don't want it. Folks, we give you the opportunity to write your own if you'd like, or you can use the one that we have. Inside the book, it's going to have who the authors are, which is Patrick Phillips and Dr. Vicki Ragnar, and then you're the one that wrote the foreword to the book. And it says there on that side over there where it says, Sincerely, Susan Smith, CMRM. No, that's a Certified Medical Revenue Manager. That is someone that's actually gone through our live training workshop, who has been certified as a Certified Medical Revenue Manager. Your name goes there, your business name goes there, all of your contact information goes directly in the book. And even during training, what we're going to show you is even better of how to place certain tabs in that book. You know, those little Post-it tabs that you can kind of stick in a book. They're little flag, little things. We're going to show you strategically where to put those, highlight certain areas of that book, so that when you give that to the doctor, they're not having to read the whole thing. They're just reading certain sections of that. The reason I'm sharing this with you right now is because I want to encourage you, if you're still thinking about coming to our training workshop, that's great. What I want to do is lead you into talking about our webinar that we're going to be doing next week. We're interviewing one of our licensees that have been with us just now 2 years. Her name's Jennifer Boyd. Jennifer Boyd took this book and she took it very seriously. She did exactly what we told her to do. She took this book, she started going out marketing. She ended up getting this book into 3 doctors' hands. And by the time that she got this done, it led her to 3 practice analyses, 3 demonstrations, and they all led to 3 closed contracts. You're going to get to hear her story and how she's still using this book and getting the business. And this is a young lady that's never been in medical billing before. So again, these are some of the things that we want to help you out with. And obviously the training workshop. Nothing's better than our live training workshop. Folks, for certain occasions, we might end up doing an online training workshop for those that just can't get here to the Dallas-Fort Worth area. However, nothing takes away really from our live training workshop. But however, what we want to tell you about our live training workshop is that we have a money-back guarantee. And this is something that Patrick has put in there, and it's actually in your purchase agreement. So it states this, folks, if at the end of this live training workshop, for any reason you feel like this is not going to work for you, it's simply too difficult, it's just not your cup of tea, we'll refund 100% of your licensing fee. So folks, we try to make it as painless as possible. I cannot think of another franchise, another business opportunity that actually will give you a money-back guarantee once you've invested in that company, and especially after you've gotten all of the material and you've gone through all of their training. No business opportunity, no franchise in their right mind would ever want to try to give back a money-back guarantee. We do. That's our commitment to you guys that are looking to get into this business.